who best to talk to us about how medical centers and all of us can respond than Dr. David S. Perlin. Welcome back to the program, and want to point out to everybody, you are from Hackensack Meridian Health, and you're the Chief Scientific Officer. Good to see you again.
Good to see you, Adam.
So there are steps that we all know we can take, wearing a mask, washing our hands. But what do we need as we watch, for instance, Arizona, where they're reaching hospital, maximum capacity? What do we need to do in those situations to avoid the fear we had going into the first lockdown, which was the hospitals couldn't deal with it?
Yeah, I think these are different times, and I think Nick made an excellent point that we have a knowledge base today that we didn't have back in early March when we were beginning to see the surge. So in New Jersey, our healthcare system saw more than 50% of the patients in New Jersey. It was just an overwhelming event. And the key deficiency we had at the time was testing. I came on your program early on and talked about the testing that we had developed for our healthcare system. And it was true then, it's true today. The difference is that we have many more platforms. They're reliable. We know how to utilize them. We can mobilize resources more effectively. And so the states and cities that are encountering surges now, hopefully they've seen and taken advantage of the lessons that we learned with our healthcare system and in the New York area and elsewhere, how to manage large influxes of patients. And that takes on sort of different levels of sort of evaluation and implementation of resources.
Dr. Perlin, we talk about how there's been lessons learned from the experiences in the New York area, New Jersey area. But even if, there are lessons learned, there's still limits to hospitals in place, right? There's still limits to PPE in place. So I guess if we do get this second wave, would it just be as devastating as the last as far as the volume of patients, but still not more easily, but more understood treatments?
There's no question that if we see a surge of critically ill patients and we have to service them, we'll have to go back to where we were back in April, where we were converting public spaces into essentially ICU wards. And then we're going to have to take large venues and convert those as well. But there is a big difference now, and part of it has to do with disease management, our recognition of disease, and part of the issue back then was we kept telling patients, look, don't present to the hospital emergency department unless you're critically ill. And what was often happening is they were so ill by the time they got to us, we had to put them in ICU, put them on ventilators, and that's what created this huge a crush of ventilators and life support systems. Today, I think we have a better sense about trying to help people at an earlier stage. So potentially that would help flatten the curve. But we also have learned a lot about how do you mobilize internal resources to build infrastructure, how to build, we built 70 ICU beds in a weekend. And I think a number of hospital systems have learned how to do this. And so we're somewhat battle tested. Nobody obviously wants a surge, but we're planning for it. We expect that we'll have as many, if not more, patients, and are planning for that. I think we have to.
Hey, Dr. Perlin, Rick Newman here. One of the dilemmas all along has been figuring out the right trade-off between economic need and public health, and that's changing. So how would you articulate the appropriate trade-offs now? I mean, what's happening in reality is we are accepting more risk in terms of public health because we, for a variety of reasons, we have to get businesses reopened or they're just going to die. We have better resources now to deal with it. How would you articulate for ordinary people and for policymakers who have to tell people what to do in their real lives? What is the right trade-off between public health and getting back to normal at this point?
Well, I think there's no question that today we have a higher risk tolerance, partly because I think people just want to resume their daily lives and their sort of normal practices, and they're willing to take that risk. But I think today we also have a little bit of a difference in that just the use of masks decreases our susceptibility and gives people a sense that, well, you know what, I can actually be with more than just one person, or will socially distance, but as long as I'm wearing a mask, I have a decreased risk. So their risk tolerance now is going up because they feel a sense of protection. And by the way, I'll lump myself in this group. We all said early on, well, maybe it's not so important to wear a mask because you're not going to be ultimately protected. But the biggest, and I think most important aspect of wearing a mask is preventing transmission of yourself to somebody inadvertently, it doesn't matter. And so now I think that overall, there's a sense that, you know what, we understand there's disease out there. We understand there's transmission, but we can help mitigate the risk. It doesn't mean there's zero risk. There is no such thing as zero risk. And in fact, we're all at relatively high risk, but we can help mitigate that. And I think that's where risk tolerance is changing in the general population, and why people feel more confident. And hopefully, they won't see the surges that we saw in the hospitals and the mortality that we were experiencing. And I think as long as those images are not in the daily view, people will tend to take more and more risk.
All right. Dr. David S. Perlin, Hackensack Meridian Health Chief Scientific Officer. We know we want you back. We're going to stay in touch, and we appreciate the insight. I think a lot of us are a little nervous about that comment about a worse wave, possibly preparing for that. But sir, thank you for joining us.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.